Good morning, good afternoon, and good evening. Thank you for virtually joining us as we review the latest situation regarding COVID-19. I'm delighted to be virtually joined by Dr. Laurent Taymans, who joins us today from Belgium. First, we're going to review the latest situation regarding COVID-19, and then what we're going to do is explore the pandemic curve around COVID-19 and how to develop broader risk management strategies to support the varying challenges that organizations and clients are facing. But before we look at those challenges, what I'd like to do is I'd like to pass to Dr. Taymans to share a bit about the current status of COVID-19 and also some of the significant changes that we've seen in the last week. So Dr. Taymans, over to you.
Thank you, James. Well, I mean, look, this has been an incredible week. We are nearly at 2 million people that have been infected with COVID and nearly at 120,000 deaths. Literally over the weekend, we waltzed past the 100,000 mark. Italy waltzed past 20,000. The UK waltzed past 10,000. Of course, in the headlines, there was the discharge of Prime Minister Boris Johnson. But I mean, besides that, it's just going to show that there is an acceleration in the number of new cases and the number of deaths, of course. We're looking at also countries that weren't necessarily infected very heavily, starting to see an upward trend. Countries mostly in Africa and in South America. This is to be expected, and it will be a significant event in the next few weeks because they will probably become the next epicenter of the disease. Cases in the US, the uptake in cases is around 5%, which is when you look at the day-on-day trend, I think it's a relatively good sign, but let's be cautious. I think that the next steps are really going to be looking at the evolution over the next few days. But yeah, back to you, James.
Thank you, Dr. Taymans, much appreciated. So with that in mind, what we're going to look at now is the concept of the pandemic curve and really how we're using this to illustrate the impact of COVID-19 on organizations. Now, although it's not based on real data, it does visualize the number of cases reported in a given country over time. The dark blue section shows where cases have possibly been supported by established healthcare networks in a country. The red section depicts a dangerous situation where local healthcare systems are overwhelmed and potentially unable to support your organization and your people. Historically, we know pandemics are expected to produce a secondary wave of cases, the secondary wave reoccurrence, which is also likely to occur with COVID-19. So let's take a look at the curve itself, and we're going to start at the beginning of the curve. And we recognize that both organizations and countries are at different points on this curve itself. We're going to talk through the various elements of support, but also some of the aspects to consider when moving to other parts of that pandemic curve. So as we start at the beginning, as cases are detected, begin to increase, as we're seeing in countries in Africa, in Latin America as examples, it is imperative for organizations to have access to timely and accurate information, both on COVID-19 and the local environment as well. And also to have tools to help proactively communicate with and educate your workforce about those risks. It's also important to be able to initiate methods for tracking your sites, your offices around the world to detect those new emerging threats as they occur. Another key aspect as you're moving through the upwards trajectory of the pandemic curve is also to seek that expert health and security advice from a medical expert, a doctor, or a security expert specializing in pandemics and crisis management and resilience, because that will help then in terms of reviewing your own policies, plans, and procedures to manage your reaction and response to COVID-19. It is also important to be able to have access to a network of providers that can provide case-by-case support for your workforce against health and security threats, particularly when you can't start to see mobility and individual movement becomes very restricted in that environment, in that location as well. As we're working our way up the peak towards the peak of the pandemic curve, and as case numbers increase, there may be recommendations to defer all travel or movement, which are likely to come into effect. And indeed, we've seen this happen in many locations around the world already. This can typically lead to a closing of operations, of offices, and or sites as well. So having access to expert medical and security advice to support your decision-making process is absolutely essential. And this upwards peak is where those decisions need to be made and to be supported. At the same time, as you're coming down the other side and the restrictions may potentially start to ease, it's about being able to speak to those experts to help you understand and make those decisions about when the resumption of operations can take place as efficiently, but also critically as safely as possible. I'll now hand over to Dr. Taymans to talk us through some other aspects of the curve.
Yeah, and actually, thank you, James. It's actually really interesting to see that, as we go up the curve, there is a moment where the healthcare system is going to be under an enormous amount of pressure, and getting to those numbers and getting to the point where there is a challenge of the healthcare infrastructure, telehealth services are going to become critical in ensuring that you can provide the appropriate level of care and medical care to your employees and to your workforce. And this is something that is at home, domestically or abroad, because let's be clear, people are not traveling the same way that they are traveling they're not traveling the same way when they are in a pandemic, and people are staying at home and people are working from home, but this does not negate the need, and this does not negate the healthcare pressure that they're going under, and it's something that we need to take into consideration. These services are something that you can give direct access to. You can give them a phone number. You can allow them to contact the medical professionals, and then you can actually have treatment plans. Well, people that have diabetes, people that have hypertension, people that have chronic health diseases, it's something that needs to be taken care of, because when you no longer have access to healthcare, when you have those chronic conditions, they can rapidly deteriorate and become either functionally threatening, but also life-threatening as well. Mental health resilience is also part of the curve, because it's actually a very anxious time for people, and it is particularly challenging even without an infection, without a pandemic. When you are isolated and when you are alone, it can become extremely challenging to keep your mood and your spirits up and to be able to continue to be productive. Those people in the workforce that are particularly sensitive to those issues, they need, at this time, mental health support, to be able to continue to function and to be able to eventually thrive through this situation. On the ground support, when we look at the pandemic curve, the on the ground support is something that is essential, especially when people are in zones or in places in the world where they don't have access to healthcare, or the healthcare system is extremely rudimentary. And that on the ground support is actually going to be something that's going to be a lifesaver for these people, because when you look at the on the ground support, we're looking at healthcare services, but we're also looking at evacuation, and it's necessary to ensure the health and safety of those employees that are trapped by having access to that on the ground support. It's important to remain attentive to ensuring business continuity, because one of the disrupting factors of this pandemic and of any pandemic is going to be the economic impact. And this is where I'm going to pass over to James, who's going to talk about the security environments.
Fantastic. Thank you, Dr. Taymans. And I think absolutely to that point around maintenance of business continuity, throughout the pandemic curve, what we have seen and we are seeing as well is that the COVID-19 pandemic can exacerbate the local security environment, and understanding that environment in the context of COVID-19 is becoming ever more important. So being able to monitor for potential deteriorations in the local security environment and the improvements as well in already fragile security environments is very critical, particularly where the COVID-19 can exacerbate those inherent security risks, but also where the inherent security risks can exacerbate the impact of COVID-19. And that could be related to socioeconomic conditions in that country. It could be geopolitical issues. It could be also xenophobic issues, as we have seen in some countries around the world as well. Protest activity, unrest, actions of the authorities and the governments as well in reacting and responding to COVID-19 can also play a part in the potential deterioration and improvement in that security environment as well. So that ability to monitor that is key. And very much as we're looking at that peak as well, we're now looking at, as we move down the other side, it's also about addressing the decreasing side as well. And it's essential that organizations are looking at that right now. And I'll hand to Dr. Taymans very shortly, but I think just in terms of being able to prepare your organizations for the safe resumption of mobility of your people, of your workforce, but also that ability to resume your operations as effectively and as quickly as possible as well. So having access to tools that can analyze the risks in all the countries you're operating in will also help to develop your organization's back to work policies and procedures. And there are also medical components, Dr. Taymans, aren't there, that organizations should be looking at as they're starting that decreasing side of the curve.
Absolutely, and I think it's important to understand that this pandemic is going to bring a new world, and we need to be able to be in a position where we need to look at our business as usual, business as usual policies and procedures, and have them reviewed in light of the new situation. And that new situation is going to be important. I mean, we need to look at different topics. When can we travel? When can people return to work? How can people return to work? There's so many questions that are being asked in these times. We're getting requests all over the place. What should we do? What is the policy in regards to someone who has had COVID-19 and that person he or she wishes to return to work? So this is where there is a recognition that there is a new world. It's important to evaluate the policies and procedures and bring them up to date. It's important to look at returning to work, and returning to work can involve return to work in the workplace, but also return to work in terms of travel. It's important also to understand that travel is going to continue to be disrupted. I think James can explain to us what is the next steps in that.
Absolutely, and I think to emphasize Dr. Taymans' points, that ability to look at return to work assessments is critical in terms of your own existing policies. And if we're looking at travel in particular, it may well be that your existing travel policy may not be sufficient given the new environment, and you may need to look at an interim version to be put in place that reflects the new normal, as Dr. Taymans has highlighted. But likewise, also understanding how you can enable your managers within organizations to make timely, effective decisions around approvals on resumption of operations, around business continuity decisions, around approvals for mobility when the opportunity presents itself to start resuming that travel or that mobility as well. But also recognizing that it should be a holistic approach, looking across your workforce and looking at how you can support all elements within your workforce as well. And I think one of the other key aspects as we are coming down the lower slopes of the pandemic curve is also to review key lessons learned as well. So to both uncover strengths of how you've dealt with the situation, but also weaknesses in your existing business continuity plans, crisis management plans, and broader resilience planning as well. And what we see typically after a crisis is this is a step that is generally omitted. And especially in the context of COVID-19, where there is that possibility of a second wave reoccurrence, this is the best time to review and address your plans. So if you find that your organization is impacted by an outbreak or a pandemic again, that will at least give you that process to be able to manage it very clearly in place and very clearly defined as well. And then I'm going to hand over to Dr. Taymans to talk about that final critical part of the pandemic curve as well.
Yeah, it's actually history. When we look at history and we look at what happened in the past, all pandemics, well, most pandemics actually had a second, sometimes a third wave. Now, the idea that the second wave may be more important or less important than the first wave is going to be dependent on the acquired immunity of the population. But it's one thing that we need to understand is we've gone through it. And we've actually, by having a systematic and a structured approach to business continuity, to protecting the workforce, either through security or medical, the fact that we've gone through it has really, has in a sort of way brought on a dress rehearsal. And that second wave should normally be something for businesses, should normally be something that is less disruptive and probably just for probably allowing us to go back to business as usual or business continuity in a much swifter and a much more efficient way. Now, one of the things that is important to note is that if you have put in place all of the correct elements in combating the curve right now, that robust business continuity plan will help you minimize the risk. And this is actually something that we're looking for in the future and will probably be a defining factor for businesses in the next few months or in the next few years, depending on how long this pandemic will last. On to you, James.
Fantastic. And my thanks indeed to Dr. Taymans for his expert insight on the situation as it currently stands and also the pandemic curve as well. So thank you very much to you also for joining us for today's virtual update. As the situation continues to evolve, please do get in touch with us to receive our up-to-date information, advice, or assistance regarding COVID-19.